I'm Wyatt Sankey, and I am presenting my capstone project on the healthcare worker shortage in the United States. Just some background on the healthcare shortage is that it is a global shortage, not just in the United States, and it's estimated that we will need 20 million more healthcare workers worldwide by 2030, more than we already have. So that's quite a gap we have to find some people to replace. The United States is in a bad way with this shortage. We're about to lose a third of our working healthcare professionals. That's in all professions, physicians, nurses, therapists, surgeons, you name it. We're about to lose a third of them to issues that will be discussed later on in the PowerPoint. By 2030, this shortage will come to a head, and it will be even worse than it is now, and it needs to be addressed before it gets to that point, or there may not be a way to pull us out of it. Some details on the actual study itself. I did a systematic review of the literature around the healthcare worker shortage, and I was aiming to find information about the shortage and why it was so prevalent, and if I could find some solutions that maybe as a future hospital administrator I could use myself or help other hospital administrators with this shortage. I worked in a hospital for 2 years prior to Corona hitting, and then I lost my job due to Corona. But the whole time I was working in this hospital, I noticed that there was constantly a shortage of staff, and we had to find somebody to replace somebody, and we needed outside nurses and doctors to come in and work because we couldn't fill the spots. And I just wanted to figure if that was just our hospital or Pennsylvania or the country or the world. And looking at the research and literature, I believe that it's mostly in the whole world, but the United States is definitely taking the most of the impact. The clinical question that I was looking to answer is what are the sources or foundational reasons for the shortage of physicians, physicians assistants, and nurses specifically in hospital settings, and how can hospital administrators impact the shortage by doing something, their own actions. So I completed this by searching these electronic databases, Credo, Medline, Sinnal, and Google Scholar, because I figured they would be the best ones to give me the information I needed. And I searched 3 terms on all 4 databases, which were physician shortage, nurse shortage, and PA or nurse practitioner shortage, because while they're not exactly the same thing, most of the literature that I found involved one or the other or both. So I just figured I'd clump them together and it would help with the data. Some criteria for inclusion of all the articles were they had to be full text about the U.S., include information on hospitals and information on the shortage and how hospital administrators can come up with a solution for the shortage in their hospital. Once I got all the articles that I thought were relevant, I deleted them, of course, and the criteria for deletion were any articles that had duplicate information from what I already had, information on other countries, other settings other than hospitals, and information that really didn't make sense to include in my paper or project. In the end, I decided to keep 37 articles. There's a lot of information on physicians and what was the problem with the shortage of physicians and how it can be helped. The information on nurses sort of mimicked a lot of the information on physicians, especially like the solution part on what you can do to prevent having a nurse shortage in your hospital or whatever things like that. So the information on nurses seems like there was a lot less, but it was already information that I had found. So it applied in most of the time both physician and nurse categories. And the NP/PA category didn't yield a lot of results for the searches or for articles that I thought were relevant, but the articles I did find were quality and they included good information. I think that the reason there was not a lot of information for these searches was that the positions are newer relatively than nurses and physicians, so a lot of studies that are done for nurses and physicians wouldn't have been done for NPs and PAs yet, or people just aren't looking at NPs and PAs through a research perspective yet. But there was definitely good relevant information for NPs and PAs, and definitely information I used. The first thing I want to talk about with the shortage of healthcare workers is COVID-19 and how that's impacted the healthcare system. It was really bad for healthcare in the U.S. Extremely bad. One of the figures I found was that there was a major loss of money, somewhere around $200 billion for U.S. hospitals and the healthcare system due to coronavirus. And the big reasons were because people were afraid to go to hospitals at first, and then now there was just a flood of people needing acute care, and hospitals aren't making any money from their other services because only necessary services are being ran right now. So the money's really being lost in treating these people with corona and not offering other services that make hospitals money. And also, because of corona, there's a huge shortage of personal protective equipment, and staffing was really affected. Like I said, I lost my job in a hospital. I know lots of administrators and managers that worked in a hospital lost their job too. And the shortage of medical supplies is hard to keep up with because corona keeps getting worse and worse every day. I mean, this week in Pennsylvania we had what, more new cases than there has been yet since coronavirus started. So it's been really rough, and it continues to be rough. It really showed how many holes there are in the U.S. healthcare system. I mean, we saw it coming for how long, and once it got here, it seemed like anybody was prepared. I mean, I was working at the time when coronavirus hit our hospital. We didn't know what was going to happen. They had us bringing clothes to work in case we had to stay there and treat patients. They had us getting laid off or telling us we were essential a different day. It was chaos. So coronavirus definitely had some positives in that it showed us that we need to be more prepared for things like coronavirus, and it showed us that we are not prepared and there are many flaws to the U.S. healthcare system. COVID also shed light on the severe lack of proper and adequate staffing in most U.S. hospitals, because most of them are having trouble even putting people in COVID units to treat all the patients, let alone staff the COVID ward plus the wards they already have. And if anybody looks at this and can tell me honestly that we don't have a staffing issue, then I'll say this whole project was bogus, but I don't think that's the case. All stories that I'm hearing from my old coworkers and people that I know that work currently in healthcare are that they're having a hard time finding anybody to work in the coronavirus unit, and then they get exposed to COVID, and then they have to quarantine for 2 weeks, and then they're even worse off. So this is a real hard time for U.S. healthcare workers. The shortage is really coming to a head because of coronavirus. We're seeing that we need more staff, and there's definitely a shortage. We just need more people, more doctors, more nurses, more bodies even, just to help treat and care for these patients. We need to focus on replenishing the staff numbers once they go down. And by 2030, we're going to lose a large percentage of our working healthcare population due to retirement. I mean, everybody's getting older and they're going to want to retire, especially after this COVID fiasco. They're not going to want to stay in the healthcare field if they can get out, knowing that they'll have this hanging over their heads to deal with. If they get sick at retirement age, they could probably die. So that's going to be an even bigger issue now, thanks to COVID-19. Rural areas are seeing really bad numbers with the healthcare shortage, as they already were, but now people are even less likely, doctors and nurses and things, to go to rural areas to work because there's no money, and the hospitals in rural areas, such as the one in Clearfield County that I used to work at, are paying people less, laying off workers, and it's just a really hard time, especially in rural areas. So we're being hit pretty hard by the shortage of available healthcare professionals. Perhaps the worst profession for the shortage of the three that I'm reviewing is physicians, and there are many reasons behind that, but there are some highlights that I'd like to cover first. The physician-to-patient ratios now are higher than they've ever been. Now, what this means is that physicians are seeing more patients at one time, and weekly, monthly, yearly, whatever you want to look at it as, than ever. One figure that I ran across in the literature was that in Clearfield County, where I live, the average patient to physician ratio is 1 to 1,500, and I'm pretty sure that figure was weekly. They see that many patients, and that's just an incredible amount of patients to see. As a physician, I don't know how they keep everything straight and remember who they're seeing, what they're seeing them for. It's dangerous. We just don't have enough physicians, especially in the rural areas, as I already talked about. A big reason for the physician shortage is that most physicians that are retiring or leaving faster than we can get new physicians in to replace them. And it's hard to replace a veteran physician with experience who knows what they're doing with a fresh out of school new physician that barely has their training wheels off. It's just difficult. So even if we could replace all physicians as they leave, it's not going to be the same. And physicians are in increased demand in all sectors: rural, urban, hospital, doctor's office, you name it. COVID has made that more clear than ever and has increased the demand greatly for, physicians in all areas. And healthcare requires physicians. Without physicians, we can't treat patients, we can't give medicines, we can't come up with treatments or develop treatment plans. It's just impossible. So physicians are the most important aspect of the healthcare shortage that needs to be addressed and needs to be solved quickly, or we're going to be in some trouble. Some foundations or reasons behind the physician shortage: burnout. Physicians spend so much time working and being on call and doing paperwork and things like that that it gets to be a lot, and some physicians don't ever seek help because there's a stigma surrounding burnout that physicians especially, should just work through it, or nurses just work through it. And they wear that as a badge of honor that they're burnt out and tired. But getting help and knowing when you need to seek help is something that physicians, especially in this time, need to learn and understand, because losing a good physician to burnout may be catastrophic to a hospital, when they could have just given them a couple of days off and had them go to see somebody, talk about how they're feeling, made some changes. There's solutions to these foundations, but they're not always talked about, or they're not highlighted, or people, like hospital administrators, managers, don't know about them. That was really the aim of my project, was to find things like this and solve them. Some other foundations for the physician shortage: non-medical tasks. That includes the paperwork, the documenting. Of course, they have to do some of it, but there's some of it that has nothing to do with what a physician is aiming to do: treat patients and help them out get healthier. So these non-medical tests are really putting a damper on the ability of a physician to do their job and increases their workload as well. The elderly population, there's more elderly individuals now than ever, and they need people to take care of them. And an increased number of patients means we need an increased number of physicians to treat them. But at the same time, these elderly individuals are aging, physicians are aging. So while the population of elderly people goes up, elderly physicians may join them, and then the physician number goes down as well, meaning we need even more physicians to treat all the older people. And that is a real issue, one that's going to be hard to resolve because the number of young people is just not as many as the elderly individuals. COVID-19, another reason for the workforce shortage. Physicians especially, are leaving the workforce, or they have too much on their plate, or they get COVID. Some of them aren't going to make it. It's just, there's a lot of factors that COVID brings into the workforce shortage. The length of education and education requirements are contributing to the shortage of healthcare workers. Not that it's a real issue that they go to school for that long, but the physicians going to school for so long is really putting a damper on the ability to replenish them, because as they're leaving the workforce, we have to wait 8 to 10 years for a new physician to start college and finish and become another physician, plus internships and residencies and all the other things they have to do. I believe that there needs to be some type of reform in the midst of this crisis that we're facing. I know normally things would be fine, but this isn't a normal situation. We're not in a normal situation with healthcare. We need more workers, we need more physicians, we need more nurses, and there needs to be something done to combat the shortage, because we can't just sit around and wait for people to be done with school. I believe that education needs to be looked at as what is necessary and what can we get rid of, and things that don't need to be in there, say some gen eds maybe, get out. And I know it's about money. The cost of education is on here too. Many people can't afford to become a doctor, or they have to pay back what they borrowed for their whole lives. And I just think that for such a necessary profession as a physician, there should be a little more forgiveness or a little more leeway in allowing people to enter this field and become a physician. I just don't understand why it has to cost literally your whole life to come up with something that everybody in the world needs. Just seems ridiculous to me. And the last thing is job dissatisfaction. A lot of physicians are unhappy with how they have to work, what they have to do. If they're not exactly getting the satisfaction that they think they should have, then they may leave, go somewhere else, or just exit the workforce altogether. Some solutions, as I already proposed on the last slide: education reform, physician duty reform, meaning we need to look at what physicians have to do and to streamline their treatment processes, especially during COVID now, to look at what they don't necessarily need to be doing, what could be delegated to other professionals or other people in the hospital, and let the physicians do physician work, treatment and diagnosis and that type of thing of patients, not this paperwork that they have to ponder for hours and fill in things on a computer. That's unnecessary. It's wasting time for physicians who need to save lives. Portable medical licensure is something that I came across in the literature that I thought had efficacy, especially for physicians who would like to cross state lines. Apparently, there needs to be a license acquired for each state before you, as a physician, can practice there. And I think that's ridiculous, where I believe that if you, a physician, have a license in one state, it should be a license for every state, because how much different could it be to treat a person in Pennsylvania versus in Florida? I just don't understand how that's such a crazy rule right now with COVID. If there's physicians that are willing to go to other states to help out, why should they have to jump through hoops just to be able to use their medical license that they paid and worked for? That needs to be fixed. Telemedicine is something that's showing moderate efficacy, but sometimes it's not as practical and hands-on as it should be, where a physician can video chat with a patient and get their symptoms and try and make an assessment based on what they can see and try and make a moderate diagnosis for the patient. That helps bridge the gap where there are no physicians and decrease wait times, and really helps with the shortage of physicians. Now, a reformation of PA and NP duties is something I'm going to talk about a little bit more in a little slides later, but PAs and NPs I feel are underutilized, and they could be doing a lot more to help with the physician shortage, but there just needs to be some sort of legislation reformation that's done to allow that to happen, especially with education. Now for the nurses. The nurses are a pillar of healthcare. Without nurses, doctors would just be saying what needs to be done and nothing would happen. Nurses complete the care for the patients. They give them their meds. They do everything the patient needs, and we need them. The nurses are the most numerous healthcare professional that's working in the United States right now. There's more nurses than any other healthcare profession. And by 2030, the United States is going to need 2 million more nurses. There's not enough new nurses to fill these gaps, and some of the reasons that we need 2 million more nurses are these foundations right here. Burnout, again, like I said, in physicians, shortage, the burnout of nurses working too many hours, working with too many patients, too much to do. It's just too much sometimes, and they would rather wear the burnout as a badge of honor than go to somebody and say, I need help, I'm working too much or working too hard. The elderly population is also going to contribute to this. We have elderly nurses that are about to retire, as well as an elderly population that's requiring especially care from nurses. So that's really contributing to how many more nurses we need. Nurses are unhappy with their job and compensation. That's something that I saw a lot of in the literature. Oftentimes nurses don't feel as though they get recognized for the hard work they do, and they just get bossed around by doctors, or the managers, come down on them for one little thing wrong when they've done everything else right. And I just feel like recognition and proper compensation are a great way to retain the nursing staff that a hospital has already, and at the same time keeping the nurses that we have in the workforce and keeping them happy until they decide to exit. The workload has gone up recently, especially due to COVID for nurses. I think that the average patient ratio now is 1 nurse to 7 patients or something, and ideally at the most it should be a 1 to 5 ratio. When I worked in the hospital, I was a nurse's assistant, nurse's aide, whatever you want to call it, and I worked night shift, and at times there were 1 to 6 patients per nurse, and that was a lot, but it was at night, so it wasn't really as bad. But now, because of COVID, those numbers are elevating, and it's getting worse. Some solutions, as I said, offering money and monetary incentives to those who do their job better, educating nurses on how to fix their problems with burnout and how to help themselves, who to go to, as a hospital administrator, creating a positive work environment would be great. Doing things such as, offering spaces for employees to go and step away for a second, or offering as many breaks as possible, giving people who are burnout some time off. Just making the work environment happy and positive can go a long way for retaining staff. Recognizing good work and just letting it be known that the person's doing good work can sometimes just be enough to keep them happy and keep them satisfied. Retaining current staff is going to be the main aim of healthcare administrators in the future, especially by 2030. Keeping the staff we have, because finding new staff is going to be more and more difficult, and replacing staff once they're gone may be impossible. Finally, we come to the PA, physician assistant, and nurse practitioner shortage. Now, the literature that I read, almost all of it, said that there is, in fact, not a shortage of PAs or NPs. In fact, there may be a surplus of these professionals. One article I read said that physician assistants are the fastest growing profession in healthcare. They have the highest number of students at the moment, and they will be vital to healthcare in the future. And how right that article was. They work almost on the same level as physicians. Of course, they have some difference in schooling and education, which requires them to need a physician's orders to complete something, but they have most of the knowledge there. And a few articles that I read talked about how PAs and NPs are improperly utilized, where they're not fully utilized to their full potential. They're seen as literally an assistant to a physician rather than somebody who can go to patients and look at them and treat them and, be there in place when a physician isn't really necessary. I think that hospitals especially would be great and better off to properly utilize PAs and NPs to fill their gaps where they don't have physicians. One article that I read actually said that the study they completed was to see if physicians or physician assistants had better patient interactions, and the PAs in the end were rated higher by the patients than the physicians. Now, I like to think that this is because physicians have sort of a complex where everyone that I've ever met in the hospital seemed like they had a big head and they were too important to bother with the likes of the smaller people. And when they talked to patients, they just said things like, "What's wrong? Where does it hurt?" But physician assistants that I met in the hospital were personable and nice, and they took the time to listen to the patient and talk to them. And I think that that was probably what had the effect on these patients in the study. So, PAs and NPs, definitely a beam of light in the healthcare worker shortage that could be utilized properly. An untapped well of professionals, if you will, that needs to be utilized properly, and the skills they have are more than adequate to help with the physician shortage. Here's just some sort of summarization of what I said about that study. We need an education reform, perhaps, if we're going to go that far with physicians. We might as well with PAs as well. An education reform being in that maybe they're taught a little bit more about, something that makes them closer to a physician so that they can be thrown into a better position to help physicians out. I don't know. The education reform just, I feel like, needs to be looked at in all aspects of healthcare. Hospital administrators in the shortage. What needs to be done as a hospital administrator to be sure that the shortage does not affect our own hospital? Retain staff, for sure. Keep the ones we have. It's going to be harder to obtain new staff once the staff we have is gone. So, to obtain new staff, I saw in the literature there's some efficacy in incentivizing, offering incentives such as, loan repayment or loan forgiveness, sign-on bonuses, um, rewards programs, that sort of thing, to attract new young professionals to replace those that retire or those that are leaving. Once a staff member leaves, they have to be replaced. That's going to be the number one thing. Safety measures. Amidst COVID, nobody wants to work where they are in danger of catching a deadly virus. So making things safe and proper for the staff is a big plus, one that can help retain staff and attract new staff. As a hospital administrator, listening to what the employees say when they come to you with a problem, or they say something's off, or they hear complaints, listening to those complaints and addressing them, actually fixing the problem for the employees, will help retain and obtain new staff. And make positive changes. Make changes that are good for everybody, that nobody's against, that are for employees, not just for the hospital, for the employees. Doing things for the employees will go a long way. Future solutions for the healthcare worker shortage. Immigration and emigration are showing they're possible. Moving physicians and nurses around. Oh, sorry. I just had something in my throat. Telemedicine is always going to be viable. Video chats and that sort of thing. Healthcare and education reform are going to be necessary. We're going to need to look at healthcare how it is and education how it is, and make it easier to fit into what we need. We need more healthcare professionals, so education needs to be quicker and more accessible if we want to fill these gaps. Or we can keep doing things the way we've been and drive ourselves further into a shortage. I'm just suggesting solutions, and nobody has to listen to me, but they will work. So in conclusion, healthcare is in danger. Solutions, even if they're not the ones that I propose today, some solutions need to be looked at and put into effect. We need to try something, because if not, we're going to be into a hole that cannot be dug out of. Things need to be efficient, they need to be fast, and they need to be soon. This can't wait. This is going to be something that affects all of us in the future and is already affecting us today. And that's the end. So thank you for listening.